Chapter 14, Mental Disorders. Treatment is antidepressants, psychotherapy, electroconvulsive therapy, and family support and education. This is one that the whole family needs involvement in. The best results are with the combination of psychotherapy and medications. Um, Grief response, if you recall back when we talked about Elizabeth Kubler-Ross's stages of grief or stages of loss, this is essentially the same area. They go through phases of denial, bargaining, anger, depression, and acceptance. Not everybody moves through all stages. Not everyone goes through the stages in order. And sometimes they will fall back into a previous stage and maybe go past the next one to the one following. So this is where it can be very different patient to patient. During the depressant stage, especially, medical intervention needs to be a part of it. Most people will recover with a small amount of medication in those cases. Anxiety disorders, everyone has anxiety at different points for different reasons. But what we're talking about here is the difference between normal and abnormal. And we're looking more at abnormal here when it lasts and prevents the person from being able to lead a normal day-to-day life. 4 classifications: generalized anxiety disorder, panic disorder, phobic disorder, and obsessive compulsive disorder. This group represents probably the largest mental health problem in the U.S., and it can lead to other disorders and even into addictions. In generalized anxiety disorder and panic disorder, then especially in general anxiety disorder, then there is a constant state of anxiety about a lot of things or most things. It isn't related to any one situation. It's just generally overall. In someone who has a panic disorder, they have to have 4 panic attacks within a month's time or more attacks that have been followed by a constant fear of another attack. So these are very closely related, but yet there are some differences. Symptoms of general anxiety disorder and panic disorder are they avoid decisions or avoid worries about what that have been made, and in panic attacks they may go from anxiety to panic. Symptoms: diarrhea, elevated blood pressure, muscle tension, inability to sleep, nightmares. They may have a sense of unrealness. They may have palpitations, their heart races, they're sweating, they're short of breath, they have chest pain, they are dizzy. So a lot of symptoms goes into this one. Phobic disorders are excessive, persistent, and an irrational fear and avoidance of phobic causes. The source can be an object, a situation, but it really doesn't pose any actual danger. It's just in their own mind. They realize that their fears are irrational, but they can't stop it. They can't change it. They often have a severe anxiety attack. They can develop from almost anything, from claustrophobia to fear of spiders to fear of going outside even. Obsessive compulsive disorder is persistent or unwanted thoughts is how this one is expressed, and compulsions, urges to carry out certain actions. Patients with complaints of persistent unwanted thoughts and compulsions and unwanted urges carry out certain actions require prompt assessment. These are, it's kind of one of those out of control categories. What causes it? A lot of theories, from extreme stress to a part of the brain, such the frontal lobe, it's dysfunction, hyperthyroidism, cardiovascular disorder. Um, so a lot of things that have been related here, but no absolute cause. Symptoms, common obsessions with harming someone else or suicide or performing some kind of immoral sexual act. And then things that we see more commonly are things like the excessive hand washing or repeatedly checking door locks, even though we know that we locked it and we know we looked before, but we got to look again. So this is kind of what you see in this kind of patient. Post-traumatic stress disorder we hear quite a bit about. It's delayed response to some traumatic event that's happened in the past, and it produces signs and symptoms of extreme stress and distress. It differs from other anxiety disorders because the stress is an external event that's happened, but it's causing overwhelming result in their nature and their thoughts. It's caused by human actions such as rape, acts of war, abuse. Those tend to get more reaction, but it can also be caused by simple things like natural disaster, a hurricane, a flood, an earthquake. It might even be a traumatic auto accident. So it can be for a number of reasons. It can Diagnosis of PTSD is a distressing, upsetting remembering of the event. Recurrent dreams and flashbacks. Flashbacks have been a big side effect of these. Avoidance of things that are associated to whatever was traumatic. Hyperarousal, so that rapid heartbeat, panic. In a lot of cases, they feel like they are back where that episode happened. Somatoform disorders are one of those that are a group, so it's not just one disorder, where a person has physical symptoms without any underlying defined cause. Symptoms are real to the person, and in other words, they're not pretending, they're not faking, but they're not confirmed. They diagnosable condition for the symptoms and disorders. There's nothing they can prove. There seems to be a family pattern to the disorder, so you see it in families more than once sometimes. They usually complain of severe pain that doesn't go away. It's also called Burkitt's syndrome, and symptoms appear before the age of 30 and continue for several years.